Mallet finger is a deformity of the finger caused by damage to the tendon on the back of your hand that works to straighten your finger. Individuals with mallet finger will notice that they have a droopy fingertip. In other words, they cannot actively straighten the fingertip. Mallet finger can occur from a jammed finger, crush injury, or a cut to the back of your finger. Depending on the injury, you may experience pain, swelling, or bruising, particularly if there is an associated fracture or break. Treatment for mallet finger typically includes continuous splinting of the injured finger for 6 weeks. The splint your therapist provides you with will keep the fingertip completely straight, meaning for the duration of 6 weeks you cannot allow your fingertip to bend. If you do, you will have to restart the 6 weeks to promote proper healing. If splinting is unsuccessful or the injury to your finger is more severe, surgery may be indicated as treatment for mallet finger. There are a variety of splints available for treatment of mallet finger, all of which function to keep your fingertips straight at all times. Your therapist will select the splint best for you to ensure comfort, or they may make a custom splint for you to wear. Follow these instructions to wash your hand in splint. To begin, make sure to get all of your materials ready before you take off your splint. This will include soap, water, medical tape, a towel, cornstarch, a Q-tip, and scissors. Tear off a piece of tape prior to removing the splint, as you will not be able to use your hand once the splint is off. Now that you have all of your materials ready, you should support your fingertip on a flat surface to remove the splint without allowing your fingertip to bend. Once your splint is off, make sure to support the finger while you wash and dry both your hand and the splint. Prior to putting the splint back on, be sure to thoroughly dry your skin and the splint, as any excess moisture may irritate your skin. One way to be sure that your skin is completely dry is to use a Q-tip and cornstarch to absorb excess moisture. Once this is completed, you may put your splint back on your finger, keeping your fingertips supported as you do so. Once the splint is on, use the medical tape to secure it to your finger. It is recommended that you wash your finger and splint at least once a day. When you do this, observe your finger and make sure there is no irritation to your skin. If you have any problems with your splint, be sure to contact your therapist. If your splint gets wet, you must change it to avoid skin breakdown. And remember, never let your fingertip bend during the 6 weeks.